Hello once again and welcome to The Verdict. Mick Cornett with Kent Myers. We're here every week meeting interesting people and dealing with topical issues. And if you've never heard the term aortic stenosis, you're going to learn about it today.
I'm so glad you said it instead of relying on me to say it. That's right. You're going to find out what it is and what you do with it and how it gets treated. And quite frankly, we're pleased to have regionally one of the outstanding, if not the outstanding, thoracic surgeons going to come in and tell us about how he replaces heart valves in the heart with just a 3-inch incision in the chest. And he's the only surgeon in the state of Oklahoma that does it routinely. And yet 18,000 people a year in this country have that kind of defect and need that kind of treatment. You're going to hear about it today from Dr. Scott Lucas. We're really pleased about it.
Fascinating procedure. You'll learn more about it today on The Verdict, and we'll be right back.
Natural gas is the gateway to a better world of energy. Instead of waiting, natural gas moves us forward now. Instead of finding ways to make dirty energy cleaner, natural gas simply is cleaner. We can use it to create our own energy, a wealth of new jobs, and keep more money here at home. Learn more at chk.com. Chesapeake, America's champion of natural gas.
Wilsey, Meyer, Eatman, Tate. We're accountants. We do taxes, business valuations, estate planning, and consulting. And we're right here in Oklahoma, working with the owners of small and medium-sized businesses. Steve Wilsey and Stuart Meyer have the resources and the experience. Wilsey, Meyer, Eatman, Tate in Oklahoma City and Tulsa.
Welcome back to the set of The Verdict. Mick Cornett with Kent Myers, and Kent's going to introduce today's guest.
Really pleased today to have Dr. Scott Lucas join us. Dr. Lucas is a surgeon at St. Anthony's Hospital. He's an Oklahoma City native, grew up here after moving in from another state, but we're glad we captured him and kept him. He did his undergraduate work at the University of Oklahoma, did his medical degree at the University of Oklahoma. He's board certified in thoracic and cardiovascular surgery. He's been in practice in that area for approximately 27 years. He is presently doing some work at St. Anthony's Hospital as a surgeon. This is his first visit to The Verdict, not my first visit with him, I don't mind telling you, and that's one reason I'm so pleased not only to have him on the show, but to be here and be able to have him on the show. Dr. Lucas, welcome.
Thank you.
Glad to have you.
Glad to be here.
I'm fascinated to know how a noted heart surgeon first got the idea that he wanted to be in medicine. Do you remember growing up in Oklahoma City when you first decided, you know, I think I'd really like to be a doctor?
I do remember that. I remember being in high school and thinking that it was interesting. I had an illness and I felt like the doctors were miracle workers.
And this was at John Marshall?
John Marshall High School in Oklahoma City. I felt like the doctors were miracle workers, and I thought I wanted to follow in their footsteps.
And so what path did you at that point decide you would take? Did you have any idea how you would end up on the road that you've ended up on?
Well, worked to get into medical school. In medical school, I thought I wanted to go into family practice, and through our various rotations, became more enamored of having a surgical and mechanical type approach to medicine. And that's how it worked out.
There's so much great work that's done with the heart in Oklahoma City, you know, through the past couple of generations.
Sure.
is part of that history part of your story? Do you feel like, to a certain extent, you've been building on what some of the pioneers of those surgeries have been accomplishing?
We always do. We always learn from those who went before us.
Well, you have developed, or always had, I don't know which, just a wonderful manner with patients.
Oh, thank you.
I know certainly most lawyers don't, and some doctors do and some doctors don't. How do you work to make your patients feel at ease, make them as confident as they can be under stressful circumstances? Is that something that's important to you?
Absolutely. I think the way patients go into surgery determines how they come out of surgery, and to a large extent. And I think, at least in my practice, education is the key. If they understand why you propose a certain procedure, what's going to happen, what are the risks, and how they're going to go through it, and how they might recover, I think they obviously do better.
The procedure we wanted to talk about and focus today is called aortic stenosis, the heart valve replacement that you have become known for. Could you kind of describe to the layperson exactly what that procedure is and how it's beneficial and different from what's been done in the past?
Sure. Focusing just on the mechanics of the procedure, I do the procedure through a smaller incision. It's the same operation that you would perform through a larger incision, but has several advantages, not the least of which is less pain and less potential bleeding, but maintains the ability of the patient to breathe a little bit better because not as much of his chest wall is disrupted. And that sort of, and cosmetic appeal to it as well, but mainly people just do better and recover faster.
Is this a situation that where there's been a long history of heart disease typically, or is this someone who just may have just had a heart attack? What type of person would find their way into your care?
This is mainly for, this particular procedure is for aortic stenosis, which is a blockage of the outflow valve of the heart. And it's generally, some people get it from a congenital defect, but most people in America now get it as an aging process, an inflammatory process that comes on over years. And as it gets worse and worse, the symptoms become more and more intolerable, then we need to fix that mechanical problem. There's not a good medical solution for it.
Let me ask about the outflow valve, just from a layman's standpoint. Obviously, outflow tells me that what function the valve performs.
Sure.
But is it getting clogged, or is it shrinking, or what's causing it not to function?
The leaflets of the valve, the structures that move back and forth related to pressure of the blood, become thickened and scarred, and ultimately calcified. And that just makes it where they can't open as well as they should, and that blocks the valve blocks the blood behind it.
And do you, in your procedure, do you actually replace the valve, or do you go and repair the valve? What do you normally do?
In this particular problem, aortic stenosis, almost always we replace the valve. Some other valve abnormalities can be repaired, but this is generally a replacement situation.
What was necessary for this breakthrough? Was it a technological advance, or was it some sort of operational advance that allowed the smaller incision to be able to perform the same procedure?
I think it was just a natural progression of surgeons trying to do a better job and make it where it's easier on the patient.
Let me do something that we haven't talked about doing, so forgive me opening my coat here, but you're going to put it, in using your procedure, you're going to put a approximately 3-inch incision here.
Correct.
To do the work. Prior to that less invasive procedure, what kind of an incision and opening up would have been necessary?
It would be an incision from the top of the breastbone to the lower portion of it.
Yeah. So, and this all would just
all be open.
And it would be open while you're doing the procedure.
Correct.
Now, is there some enhanced risk to the patient being that, particularly perhaps an elderly patient, being open that long or that much?
It's not so much opening that long, it's just it's a bigger insult to the body to have more opening, more pain. The ribs are attached to the breastbone, and that's how you breathe. And that disruption is just a little bit greater, so there's more respiratory problems after surgery with the bigger incision.
People are living longer. We also seen the addition of cholesterol-lowering drugs that many people take. How have those two advances changed the job that you and your cohorts do?
The baby boomers are coming of age for coronary disease and aortic stenosis, and so the numbers of patients that we see certainly greater. And,
are they older in general?
older, and I think a little bit sicker than we would have seen several years ago.
And why would they be sicker?
Advanced age, more unhealthy habits that some people have not changed.
Right. And as far as the cholesterol-lowering drugs, how has that affected the industry?
It's affected probably the secondary prevention. In other words, perhaps the coronary disease was not prevented, and intervention of some sort needed to be applied. After that, we aggressively lower cholesterol, and that helps with our long-term results.
Are there some people with low elements of cholesterol that still need your type of procedure?
Yes.
And what would cause that?
The valve problems are not as directly related to cholesterol as the coronary artery problems are.
I see. We're visiting with Dr. Scott
Go
Lucas.
ahead. No, go ahead.
We'll go ahead and get to a break. A noted heart surgeon right here in Oklahoma City. You're watching The Verdict. We'll be right back.
The thing that has made the most sense for me is realizing that I am still an educator, and that is what I do at the Chickasaw Nation. I'm Dr. Amanda Cobb-Greetham. I'm a historian, and I'm Chickasaw. The Chickasaw Cultural Center is amazing. It is a very, very special place devoted to the sharing and to the celebration of Chickasaw history and culture. State-of-the-art technology, exhibits that are not like anything I've ever seen. The Spirit Forest is incredible, and you feel as if you have actually just walked into a forest with huge trees all around you. It's timeless, and yet it's sort of also representative of our time depth, to really just sort of reach through time and touch the past. By the end of the exhibits, you really have a sense of Chickasaw cultural and political resurgence, and the extent to which we are a healthy, dynamic, and vital tribe today. Chickasaws have always been an inclusive people. This is something for the whole community and for the state of Oklahoma.
The oil and natural gas industry help provide a revenue that feeds our schools, providing a better education for not only my kids, but for children all over the state.
It will allow the schools to buy better equipment. We'll be able to hire qualified teachers, all around to have a better educational experience.
The future has never been brighter for our students here.
We should be very proud of the oil and gas industry in Oklahoma.
When you have something important to communicate, it becomes clear that there's a lot of competition for your audience's attention. So how can your message stand out and actually resonate with your audience? Legal Graphics has the answers. The team at Legal Graphics will work with you to plan, design, and even test your presentation to ensure your message will be heard and remembered. Call Legal Graphics today to schedule an appointment. The readiness is all.
Welcome back to the set of The Verdict. We're visiting with Dr. Scott Lucas. Kent, where to from now?
Dr. Lucas, I was wondering if you had some thoughts or comments about Oklahoma's population experience with this aortic stenosis as opposed to perhaps some other states. Are there lifestyle choices or experiences that Oklahomans are having that make our incident of a need for this surgery greater than other places?
I think so, not particularly the valve surgery that we talked about, but coronary surgery, the arteries that supply blood to the heart. There are certainly some lifestyle issues in Oklahoma that perhaps could be healthier. That would include smoking, cholesterol control, exercise, obesity, some of the things that we see that certainly could make for a healthier person.
Well, I was asking you about Oklahoma's outrageous obesity rates that come through. How does that affect your job and the patients that you see?
Well, two things. One is with obesity comes diabetes a lot of times. That it can potentially interfere with healing and cause trouble with the interventions that we do, either bypass or stenting, may not last as long. And the other is simply getting through the operation with more problems of ambulation, getting up after the surgery, healing, simply there's more size, and problems with wound healing mainly.
Generally, in an obese person, is the heart enlarged?
The heart's enlarged related to the high blood pressure that usually accompanies the obesity.
Can we talk about the valves that you put in?
Sure.
Can you kind of tell our viewers what kind of valves you replace? You use as replacements, I should say.
Well, when we replace a valve, we have a choice between two main types of valves. There are cadaver valves, which are used in certain situations, but mainly we're looking at mechanical valves versus biologic valves. The mechanical valves are man-made. The biologic valves are constructed with tissue obtained from a cow or from a pig.
What are the mechanical valves made out of? What kind of material?
It's a hard substance called pyrolytic carbon. That's sort of a diamond-like substance, which just lasts basically forever.
Will it set off a metal detector?
No, it won't. No, it won't do that.
How long have you been doing this minimally invasive technique?
About 15 years.
Really?
Mm-hmm.
And you're still the only one that regularly does it here in Oklahoma,
Yes.
what I understand. How did you first learn about it and decide to try to use it?
Well, as we share information in medical meetings and all, I saw people doing it and went to study at the Cleveland Clinic and learned their technique and went on to apply it here to patients in Oklahoma City.
How do you explain it not necessarily being in wide use here in Oklahoma City?
Well, it's more difficult to perform.
Is it?
And I think that would be the main reason. The operation underneath the small incision is exactly the same as you would get through a big incision.
I have to ask this really
Sure.
layman, stupid question, but how do you see? Is it more difficult for you to see what you're doing, or are you doing it in some kind of robotic fashion? Or
Not using robotics in this particular application, but what you need to see for the aortic valve replacement is exactly what you would see with an open or larger incision surgery. You simply look at that small area, which is perhaps somebody said the size of a quarter, and that's true. You don't need to see the rest of the heart. The rest of the heart doesn't need to be exposed.
And there's only the outflow valve for which this procedure is usable, or are there other valves?
Well, sure. We could approach the mitral valve, which is another valve that needs repair or replacement quite often, through another minimally invasive approach.
When you see the numbers about Oklahoma's health issues, whether it's smoking or obesity or like issues, what concerns you the most? But if you were involved in the public health of this state, what would you say, if we could do one thing that I think would really help the state of Oklahoma's health and help lower the amount of heart disease, it would be what?
Well, I think the main answer would be screening, screening for obesity, diabetes, changing smoking habits, and treating some of the causes that we know will eventually cause problems with the heart. That would also include hypertension, high blood pressure.
Mm-hmm. The health care plan that passed through Congress last year, would it affect what you do on a general basis?
I'm not certain I understand that health care bill.
And how would it be implemented? Is that
correct?
Your concern?
I think that there has to be a large component of screening to prevent our problems.
Right.
And there has to be patient compliance to prevent our problems. The largest amount of money, of course, is spent at the end with these expensive reparative procedures. And if we could prevent a lot of that, we'd certainly save money, and I think that's probably the public health issue.
Mm-hmm.
Let me ask you about generally the results that you hope to see in particularly senior citizens with this kind of treatment. What do you hope will be the recovery rate, and what do you hope will be the activities that they may be able to resume that they haven't been able to do before?
Sure. Well, two main concerns about aortic stenosis that we've been talking about. One is simply survival, and the other is quality of life. And I think that as we mentioned before, the baby boomer generation is coming into the age where a lot of aortic stenosis is seen. And so we're allowing these people to get rid of their symptoms and to recover a lot quicker. Age has not been a contraindication, and we have operated on lots of people that are in their 80s. The oldest person I operated on, I was 97 years old, and he's now 110. So,
oh you have a 110-year-old patient or former patient?
Mm-hmm.
Well, congratulations.
Wow.
You must have done something right.
Well, he was very healthy, a lot younger than most people that are 97, if you will, but he did very well.
Did you ever think, he's 97, why are we putting him through this?
When I first saw the age, I worried about that, but when I saw him, he was one of those people that just was a young 97, if you will.
Mm-hmm. Okay.
Let me ask you, once the surgery anesthetic is worn off and the pain of the incision or whatever may be come along with it has subsided, how soon will a patient feel differently, feel better, be more active, be able to do things that they haven't been able to do perhaps for years? How quickly will they feel that?
Well, interestingly, most patients know the day following surgery, when they become more conscious, that something is better with the function of the heart. They simply feel better. The family reports better color because we've abruptly changed the mechanics of the heart into a much better situation. Patients feel better as they get over their pain, and if they have no post-op complications, a couple weeks they're up and around and doing pretty much what they want to do. The recovery is a lot faster with smaller incisions, and that's what we're after.
There are no doubt breakthroughs ahead.
Correct.
What are research scientists working on that you think will fundamentally change things for your profession?
I think if we look with mechanical problems of the heart, mainly valve surgery, we're looking at different ways to utilize valve techniques in different access modes. And I think smaller incisions, robotics is certainly here. Applying the valves through arteries, peripheral arteries coming from the femoral artery in the groin is here. It's not mainstream yet, it's investigational, but certainly those sort of procedures are being developed as we speak, and will be in 5 to 10 years more mainstream.
Awesome. Dr. Scott Lucas, thank you so much for coming on The Verdict.
Sure, you
Really
bet.
do appreciate it, Doctor.
Sure, you bet.
And Kent and I'll have a final word when we get back.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
In Oklahoma, we enjoy a high quality of life due to good, well-paying jobs. Commercial real estate professionals play a significant role in bringing new businesses and investment to Oklahoma. The commercial real estate community has come together to market Oklahoma's commercial properties nationwide through a free public website, okcommercialproperty.com. We are invested in keeping Oklahoma strong and growing because economic development ensures quality of life.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information. And for almost 30 years, Oklahoma political, government, and business leaders have turned to the McCarville Report for accurate, reliable, inside information. Visit the McCarville Report online.
Welcome back to The Verdict. We're wrapping up a show with Dr. Scott Lucas. We learned a lot about heart surgery today and some very specific techniques that he's involved with.
Well, he is indeed a noted heart surgeon, and we're very fortunate to have him here in Oklahoma City.
Absolutely. We have some website information we'd like to pass along to you. If you'd like more information, you can find out more at the website at St. Anthony's, which is www.saintsok.com. Or if you have an idea that you'd like to see about a future show here on The Verdict, we'd like to hear from you. Our website is theverdict.tv. That's theverdict.tv. Log on, tell us what you think, and perhaps we'll see your idea on a future edition of The Verdict. For Kent, I'm Mick. We'll see you next week.
The preceding program was produced exclusively for the Cox Channel.